Stick out your tongue, right now, in front of a mirror, under good light. Take 10 seconds and actually look at it. Most people over 60 haven't done this in years. They brush it while brushing their teeth and never think about it again. But that small piece of muscle sitting inside your mouth is one of the most honest health reports your body produces. It has no filter. It doesn't know how to hide what's happening inside you. In 12 years of clinical practice, I have watched tongues reveal anemia before blood tests caught it. I have seen them signal circulation problems weeks before the first chest symptom. I have seen them warn about neurological changes that the patient themselves had not yet noticed. And I have seen, more than once, a small patch on the side of a tongue turn out to be something that should have been looked at 6 months earlier. The tongue is not just for tasting and speaking. It is a living map of what is moving through your blood, your nerves, and your tissues right now. And after 66 specific warning signs on that map deserve your attention more than almost anything else you can check at home. Most people miss all 6. By the end of this video, you won't. I'm Dr. Nora Khalil. For the past 12 years, my work has focused on helping people over 60 understand what their bodies are actually telling them so they can protect their independence, their energy, and their clarity for as long as possible. That's what this channel is about. Not fear, not noise. Just the things that genuinely matter for your health after 60, explained the way I would explain them to my own parents. If that's the kind of guidance you've been looking for, go ahead and subscribe and tap the like button if this opening already feels useful. It helps more people your age find this channel, and that matters to me. Now, let's look at your tongue properly. Here is the first thing I want you to understand, because almost no one is taught this. A healthy tongue has a very specific appearance. It should be a soft pink color, evenly distributed from the tip to the back. It should have a thin, almost transparent whitish film, never a thick coating. The surface should be slightly moist with small papillae, those tiny bumps, visible but not inflamed. It should move symmetrically when you stick it out, without trembling, without pulling to one side, without stiffness. That is the baseline. Everything else is information. The reason the tongue is such a powerful early warning system comes down to its biology. It is one of the most vascularized tissues in the entire body. The amount of blood flowing through it, relative to its size, is extraordinary. That means anything happening in your circulation, your oxygen levels, your red blood cells, your nutritional status, shows up on the tongue almost immediately. On top of that, the tongue is controlled by several cranial nerves that come directly from the brainstem. So neurological changes also reveal themselves here, often before they reach the hands or the legs. Blood supply plus nerve supply plus a surface you can see without any equipment. That combination is why doctors in traditional medicine across the world, from ancient Greece to classical Chinese practice, have examined tongues for thousands of years. And modern medicine has quietly confirmed much of what they observed. The tongue tells the truth. Now let's go through the 6 signs that deserve your full attention after 60. The first sign is a tongue that has lost its pink color. Instead of that healthy rose tone, it looks pale, washed out, sometimes almost white, as if someone had turned down the saturation on a photograph. Many people over 60 have this and don't realize it, because the change happens gradually. They compare their tongue to what they saw yesterday, not to what they saw 10 years ago. A pale tongue is almost always a message about your blood. Specifically, it tells me that the hemoglobin levels, the part of your red blood cells that carries oxygen and gives blood its red color, may be lower than they should be. This is anemia, and after 60, it is far more common than most people think. It can come from low iron, from vitamin B12 deficiency, from folate deficiency, or from a slow, chronic loss of blood somewhere in the digestive tract that the person has not yet detected. The problem is that the symptoms of anemia are often blamed on age itself. Tiredness, shortness of breath climbing a few steps, cold hands, difficulty concentrating, a general feeling of having less stamina than you used to. People tell themselves this is just what getting older feels like. Sometimes it is. And sometimes it is a correctable deficiency that has been sitting there for months, quietly draining energy and, more importantly, quietly reducing the oxygen reaching the brain and the heart. After 60, that second part matters enormously. A brain that is chronically under-oxygenated ages faster. A heart that is working harder to compensate for low hemoglobin wears down faster. The pale tongue is not just a cosmetic observation. It is a signal that the whole system may be running on less fuel than it needs. And the good news is that once the cause is identified, often with a simple blood test your doctor can order in 5 minutes, most cases respond very well to treatment. Energy returns, clarity returns. The tongue itself returns to pink within weeks. The second sign is a thick coating on the surface of the tongue. I want to be precise here, because this is where confusion happens. A thin, nearly translucent whitish film is normal. What I'm talking about is different. It's a dense, visible layer, white or yellowish, sometimes almost pasty, that you can actually see from a short distance without leaning in. In some cases, you can scrape part of it off, and it comes back within hours. Most people who have this simply brush it and move on. That's the mistake. A thick tongue coating is rarely just about oral hygiene. It's usually the visible end of something happening deeper inside the body. The most common cause after 60 is an overgrowth of Candida, a type of yeast that normally lives in small amounts in the mouth. When the immune system weakens, when antibiotics have been used recently, when blood sugar is poorly controlled, or when certain inhaled medications for the lungs are being used daily, Candida multiplies and forms that thick whitish layer. Left alone, it can spread to the throat and interfere with swallowing and taste. A yellowish coating points in a slightly different direction. It often reflects problems with digestion, with bile flow, or with chronic inflammation in the stomach or intestines. In traditional diagnostic systems, a heavy yellow coating was always linked to what they called internal heat or digestive overload. Modern gastroenterology has found real correlations here, particularly with conditions like chronic gastritis, H. pylori infection, and sluggish bile drainage from the gallbladder. And here's something most people never connect. A persistent thick coating is also associated with dry mouth, which after 60 is extremely common and often caused by medications for blood pressure, depression, allergies, or sleep. When saliva production drops, the natural self-cleaning of the mouth stops working, bacteria and yeast accumulate, and the coating thickens. Your tongue is telling you your mouth is too dry, and that dryness has consequences far beyond comfort. It affects digestion because digestion starts with saliva. It affects the health of your teeth, and it affects your ability to taste food properly, which is one of the quiet reasons some older adults lose interest in eating and begin to lose weight they cannot afford to lose. The third sign is the opposite of the first. Instead of a pale tongue, you see one that looks unusually red, sometimes almost raw, and often smoother than it should be, as if the small bumps on the surface had been polished away. People sometimes think a very red tongue looks healthy because we associate red with vitality. In this case, it doesn't. A bright red, smooth, sometimes burning tongue is one of the most reliable visual signs of specific nutritional deficiencies that become more common with age. Vitamin B12 is the most important one. Folate is another. Iron deficiency, in a more advanced stage, can produce it as well. These nutrients are essential for the constant renewal of the cells on the tongue's surface, and when they run low, those cells cannot regenerate properly. The papillae flatten, the surface becomes inflamed, and the color shifts toward an angry red. Why does this matter so much after 60? Because the same nutrients that keep the tongue healthy are the ones that keep your nerves and your brain healthy. B12 in particular. A deficiency in B12 can quietly cause memory problems, balance issues, numbness in the feet and hands, and mood changes. By the time those symptoms are obvious, the deficiency has often been present for months or even years. The tongue frequently shows it first. There's another cause worth mentioning, A very red, painful tongue can also appear when there's a reaction to certain medications or when there's an underlying condition affecting the whole body's inflammation levels. And this is where the picture becomes more important. A red, inflamed tongue is almost never an isolated event. It's usually part of a pattern that includes fatigue, digestive changes, or subtle neurological symptoms that the person has been dismissing. Seen alone, it looks like a small detail. Seen in context, it's often the visible tip of something the body has been trying to flag for a long time. If your tongue looks noticeably redder than it used to, smoother than it used to, or if it burns or stings when you eat certain foods, that deserves a conversation with your doctor and almost certainly a blood test that checks B12, folate, and iron. These are cheap to measure and usually easy to correct. What you don't want is to leave them unmeasured for another year. Before we move into the fourth sign, I want to share something connected to what we just discussed, because several of the signs we're covering, pale tongues, inflamed tongues, and especially the one I'm about to describe next, share a common thread underneath them. That thread is the quality of your blood flow and the thickness of the blood itself. There's a traditional practice from a specific region of Costa Rica that has drawn attention recently because of what it seems to do with blood viscosity. The idea behind it is simple. When blood becomes thicker than it should be, often because of a specific type of toxin that standard tests don't look for, circulation slows down, pressure rises, oxygen delivery to the tissues drops. And the tongue, being one of the most vascular tissues in the body, is one of the first places to reflect it. This particular ritual focuses on helping the body clear that thickening factor naturally, which in turn has been associated with blood pressure settling closer to the healthy 120/80 range, and with improvements in how the body manages stored fat. I'm not going to go deep into it here because there's a presentation that explains the mechanism properly, and I'd rather you hear it from the source than get a watered-down version from me. I'll leave the link for you in the description below. If anything we're covering today resonates with you, it's worth a look when you have a quiet moment. Now back to the signs. The fourth sign is one I want you to take seriously every single time you see it. A tongue that has shifted away from pink and toward purple, bluish, or darkened in tone. Sometimes the whole tongue, sometimes just the underside, where large veins run close to the surface and the color is easier to see. This is a circulation sign. And after 60, circulation signs are never background noise. A bluish or purple tint usually means that the blood reaching the tongue is carrying less oxygen than it should, or that it is moving more slowly than it should. The first scenario points to the lungs or the heart. If the lungs are not bringing enough oxygen into the blood because of conditions like chronic obstructive pulmonary disease, long-standing smoking damage, or untreated sleep apnea, the hemoglobin in the blood stays darker, and that darkness shows in tissues with high blood flow. The tongue is near the top of that list. The second scenario points to the heart or to the venous system. When the heart is not pumping strongly enough, or when blood is struggling to return from the body back to the heart, it pools in the tissues. That pooled blood loses oxygen and takes on a purplish color. In people with heart failure that hasn't been diagnosed yet, or with chronic venous insufficiency, this darkening of the tongue can appear long before the legs swell noticeably, or the breathing becomes obviously difficult. There's a third possibility that matters specifically for this age group. A darkened tongue can reflect a state where the blood itself has become more viscous, thicker, harder to move through small vessels. This is connected to dehydration, to certain metabolic conditions, and to inflammation that has been present for a long time. The body compensates for a while, but the signs eventually surface. The tongue is where you can see them without any equipment at all. Here's what I want you to do if you notice this. Don't panic, but don't dismiss it either. Check it in natural light, not fluorescent bathroom light, which can distort color. Look at it on 2 or 3 different mornings to make sure it's consistent. And if the purplish or bluish tone is really there, bring it up at your next medical appointment directly. Ask for an assessment of your heart function, your oxygen saturation, and your circulation. These are not dramatic tests. They are quick, painless, and they can catch problems early enough to make a real difference in how the next 10 years of your life feel. The fifth sign is the one I want you to remember the most clearly from this entire video. Any sore, spot, patch, or area on the tongue that does not heal within 2 to 3 weeks. The mouth is one of the fastest healing tissues in the body. Cut the inside of your cheek with a sharp piece of food, and it's usually gone in a few days. Bite your tongue, and within a week you can't find where it happened. That's how the oral tissues are designed to work. So when something on the tongue stays there week after week without getting smaller, without changing in the right direction, the normal healing process is being interrupted. And the reason it's being interrupted is what needs to be identified. Most persistent sores turn out to be benign. Irritation from a sharp tooth, from a denture that no longer fits well, from a medication, or from a low-grade infection. All of these are manageable once identified, but a small percentage of lesions that don't heal are something else, and that something else is exactly why I'm asking you to take this sign seriously. Oral cancer, including cancer of the tongue, is far more common after 60 than most people realize, and the outcome depends almost entirely on how early it's caught. Caught early, the treatment is often straightforward, and the long-term results are excellent. Caught late, everything becomes harder. The warning signs to pay attention to are specific. A red or white patch on the tongue that has been there for more than 2 weeks, a small ulcer or sore that doesn't heal, a thickening or a lump that you can feel with your finger or your opposite side of the mouth, an area that bleeds easily when touched, pain that starts in the tongue and radiates toward the ear because the nerves of the tongue share pathways with the nerves of the ear. Difficulty moving the tongue in one direction that wasn't there before. Risk rises significantly with a history of smoking, with heavy alcohol use over many years, and with chronic irritation from poorly fitting dental work. But I want to be clear, people with none of those risk factors can also develop these lesions, and I've seen it happen. The rule is simple, and it's the only rule you need to remember from this section. If something on your tongue has been there for more than 2 weeks and isn't clearly getting better, see a dentist or a doctor and ask them to look at it specifically. Don't wait for your next scheduled appointment. Don't hope it will go away. 2 weeks is the threshold. That one habit alone can change an outcome dramatically. The sixth sign moves us out of color and texture and into movement. And this is the one that connects the tongue directly to the brain. Stick your tongue straight out in front of you and hold it there for 5 seconds. Watch what it does. In a healthy person, it stays centered, steady, and relatively still. Now pay attention to these 3 things. Does it drift to one side instead of coming straight out? Does it tremble visibly while you hold it there? Does it feel stiff or harder to move than it used to when you speak or when you try to move it from side to side? Any of these changes deserve attention because the tongue is controlled by nerves that connect directly to the brainstem. When the brain sends an abnormal signal, when a nerve pathway is damaged, or when the muscles of the tongue themselves begin to weaken, it shows up in movement. A tongue that drifts to one side when extended can be a sign of a previous small stroke, sometimes one the person didn't even know they had. These so-called silent strokes are more common after 60 than people realize, and they leave behind subtle neurological signs that accumulate over time. A tongue tremor can be associated with early Parkinson's changes, with certain medication effects, or with specific nutritional deficiencies affecting the nervous system. Stiffness and difficulty with tongue movement, especially if it's combined with any change in speech clarity or in swallowing, can point to neurological conditions that are much more manageable when caught early than when discovered late. I don't want this to sound alarming because most of the time small changes in tongue movement are not signs of something catastrophic. But after 60, they're worth noticing and worth mentioning to your doctor. Neurological changes rarely announce themselves loudly. They whisper first. The tongue is one of the places where those whispers are visible because you can see the muscle directly instead of trying to interpret what's happening inside the skull. And there's one more element here that I want to mention. If you notice that your tongue has been feeling different when you eat, that food gets stuck more easily, or that you're biting your tongue more often than you used to, those are also signs that the coordination between brain and tongue has shifted. They're not always serious, but they're information, and information is what lets you act early. Now that you know the 6 signs, I want to give you something practical you can actually use, because knowledge without a simple routine rarely translates into action. Once a week, in the morning, before you brush your teeth, before you eat or drink anything, go to a mirror with good natural light if possible. Stick your tongue out gently and look at it for about 30 seconds. Check the color from tip to base, check the coating, check whether there are any patches, sores, or areas that look different. Then extend it straight forward and hold for 5 seconds, watching for tremor or drift. Then move it slowly to each side. The entire examination takes under a minute. If you want to be more thorough, take a photograph with your phone once a month in the same lighting at the same angle. After 3 or 4 months, you have a visual record that you can compare. Changes that happen gradually are invisible day to day, but obvious when you can see last month next to this month. This is the same principle that works for watching a mole on the skin. Photographs don't lie about gradual change. When you see something that concerns you, the right response is not to diagnose yourself from a video, including this one. It is to bring what you observed to a professional who can examine you in person. Your doctor, your dentist, or both, depending on what you noticed. Tell them specifically what you saw, when it started, and whether it has changed. That specific information helps them decide what to check and what to rule out quickly. The most important thing I can tell you about this whole system is that it costs you nothing. No appointment, no test, no subscription, no equipment beyond a mirror, and a minute of your time. The tongue is already doing the work of reporting on your health. All you have to do is learn to read it and then actually look at it from time to time. That alone puts you ahead of the overwhelming majority of people your age who will never examine their tongue even once this year. Here is what I want you to leave with. The 6 signs we covered today, pale color, thick coating, bright redness, purple or bluish tones, sores that don't heal, and changes in movement, are not about fear. They are about attention. They are about giving yourself the small, steady advantage of noticing things early, when they are still easy to address, instead of late, when they become harder and more disruptive to your daily life. After 60, the difference between aging well and aging hard often comes down to exactly this kind of quiet awareness. Not drastic changes, not extreme routines, just the willingness to look at what your body is showing you and take it seriously when something is worth taking seriously. Your independence, your energy, your clarity of mind, the freedom to do the things you still want to do with the years ahead, all of these are built on a foundation of small observations made on ordinary mornings, a tongue in a mirror, a minute of your time, a willingness to pay attention. If this video helped something click for you, I'd like to ask one small thing. Send it to someone you care about, a parent, a friend, a sibling, anyone over 60 who might benefit from knowing these 6 signs. You may give them a chance to catch something that would otherwise have gone unnoticed for another year. And if you want to go deeper into the kind of small adjustments that protect your heart and your circulation as you age, I want to point you toward another video I made recently called "Sleeping in this Position Can Ease the Heart and Reduce the Risk of Stroke After 60." It connects directly with some of the circulation signs we discussed today, especially the darker toned tongue, and it covers something most people have never been told about how body position during sleep affects the heart and the brain. It's a natural next step from this one. You'll find it on the screen now. Take care of yourself, look at your tongue this week, and I'll see you in the next video.